Very much. Thanks for having me, Brittany. This is my daughter, Lee. I've been here to speak a few times the last few years. Anyway, I'm a neurologist, practice at Clemson Neurology, went to med school at MUSC, and did my internship, residency, and fellowship in neurology at MUSC. Neurology is the medical diagnosis and treatment of diseases of the brain, spinal cord, and the peripheral nerves. Right now there's a severe shortage of neurologists in the world, especially in the U.S. As the population ages, a lot of military injuries, unfortunately, ballistic injuries that neurologists are asked to see. Brittany was telling me military recruiters come and talk with y'all some. So when I was a resident, I applied to the Navy several times. They didn't want a neurologist. We don't need neurologists. So now they, of course, they have a drastic need for neurology. But the society as a whole has a need for neurology. I'm from Hartsville, South Carolina. I went to Francis Marion. Then I kind of took a circuitous route to medical school. I'm actually a chiropractor. Went to chiropractic school in St. Louis, Missouri for a few years. Then I moved back to Florence and practiced in Florence for 7 years. My brother, who's a family doctor, he and I were jogging one spring day, and I kind of had an epiphany. I should apply to medical school, and that's when I decided to apply. And didn't expect to get in, but did get in. And so I went through the third year. The first 2 years are basic science, of course. Went through the third year. I really enjoyed neurology, and I thought I might want to be a neurologist. That's the only rotation they asked me to come back and do a fourth year. And I hated OB. I hated surgery, but I really had an interest in neurology. So stayed at MUSC and did that. Neurology is kind of interesting. It's kind of a cross between orthopedics, physiatry, and psychiatry. A third of our boards are psychiatry, and a third of what we do is psychiatry. We're not psychiatrists, but still we have the same specialty board, the American Board of Neurology and Psychiatry, or Psychiatry and Neurology. But it's a very interesting specialty. You get to interact with all the medical specialties, all the general medicine, family doctors, internal medicine. It can be demanding. Internship's the most demanding part of all of it. But once you get that behind you, then you can moonlight some. There's some practicality to what you're learning. You'll apply it. So it's fun. It's demanding but fun. What else should I tell about?
So before you went back to med school, what were you doing?
I was practicing chiropractic.
What made you go into that?
I was a chiropractic patient growing up, and I enjoyed it. And I had a friend who worked for a chiropractor, and she talked me into visiting with him. One thing led to another. I decided to pursue that. So that's 4 years also. So it was I did it kind of on an expedited 3.5 years. Then moved back to Florence and practiced there. So I didn't start med school till I was 30. And so I'm 50 now, right at 50 now. So, but the time flies by. It'll go before you know it. When you look at, one thing about med students, a lot of people plan what they're going to do next week, and next, we might go here, we might go to the beach next month, but med students, you have to plan in decades, and so you don't have to be the smartest person around. You just got to have the stick-to-itiveness and the ability to defer gratification, because there's a lot of that. Getting ready for med school, taking the MCAT, all the labs with the pre-med, and I used to hate labs, but it's just paying the price, delayed gratification. You'll be glad you did. I'm glad I did. I think back now when I remember when I was in college, it was always a beautiful day, and there was a 3-hour lab to do. I wanted to go do something, and cabin fever. But you know, if you stick with it and pay the price, you'll be glad. And medicine still, despite all the changes, is still rewarding. I'm not jaded yet. I've been practicing neurology for 11 years. So not jaded yet. And I guess it's because there's such a demand. People appreciate it.
Do you think because you did the 7 years of chiropractics, do you think that helped you at all going back to med school and then working afterwards?
Yeah, absolutely it did. And I'm just used to dealing with people and touching people. I mean, that's a lot for people to get used to. Examining people, touching them. People just aren't. A lot of people have qualms about that. I remember when we were third-year medical students, first-year medical students, we had a clinical course and we had to go, you know, auscultate and palpate some guy's chest. I just went and did it. I didn't even think anything about it. But the girl beside me, she was just broken out in a sweat, and the other people were nervous too. So there's one thing to having some years under your belt to deal with people before going to med school. I think it really helped me a lot, just in dealing with people. Yes, sir.
Can you go through a regular day-to-day of what you do?
Sure, yeah. Well, a typical day for a neurologist, usually get up and go round at a hospital. I'm going to call it 2 hospitals. So I'll get up and go round at a hospital, and I'll go get to the office about 8, start seeing patients. And I'll see patients till about 5. I try to take about an hour for lunch. I try to get outside, get some fresh air, take a breather. Then after 5, I'll either go read EEGs or I have to go back to the hospital and round some more. So some days it can be a long day. I've had some 100-hour weeks. You know, I didn't have many of them when I was an intern, but I have had some in the past few years. So sometimes it really explodes. You know, but 60, 70-hour week is not unusual. That would be the norm, I would think. Sometimes it explodes. Sometimes I'm not that busy. You've got to be prepared to do it if it comes down.
What about your call schedule?
Call can be kind of tough. It depends. Some neurologists are refusing to take call now, and they can kind of get away with it because of the shortage. But typically, I'm on call every night. But I've got an agreement with the hospital, and I bit the bullet 3 years ago and became a hospital employee. So I've got an agreement. They don't bother me too much at night unless it's really a bona fide emergency. But call can be demanding, and call can kill you. I mean, I'm not trying to be melodramatic. It can make a person sick. If you're not getting your sleep, not getting restorative sleep over time. When we were interviewing, my wife and I went all over Georgia and South Carolina. Every town we went to, well, what happened with Dr. Smith? Why are you interviewing for a neurologist? Oh, he died. And so you got to be careful. You can. It's good to be in demand this day and age. A lot of people don't have jobs, but you got to draw the line somewhere.
Don't work yourself to death. Right?
Yeah, it can have literally. You can work yourself to death.
How is it different being at the hospital now than being in was it private practice?
Yeah, I was in private practice and decided back before the 2008 election I wanted to come under the umbrella of a hospital. They provide things that I simply couldn't afford, like retirement for long-term employees. I've got some nurses that have been with me for 7 years, and you know, there's no way I could fund that. But the hospital pays for that. Malpractice creeps up a little bit every year. Mine's about 16 or 17K right now, and so they take care of that. And there's just a lot of things that it's hard for a private practice doc to do that they take care of.
You think that was a good decision?
I think so. I mean, there's a lot of stuff you have to put up with red tape. If I want to hire somebody, I just go hire them. If I want to buy an EEG machine, I just go do it. Now there's a lot of red tape and bureaucracy I have to cut through, but I think it's worth it right now. There's more and more practices are being swallowed up, and Hospitals want to do that. They don't mind doing it right now. So there is that security. The reason they do it, and it's an unspoken rule that if a hospital buys your practice, you're going to send all your diagnostics to that hospital. And it's not mentioned, and it's not talked about CAT scans, MRIs, X-rays, things like that that are lucrative to hospitals. So if you're a hospital employee, it's assumed that you're going to send diagnostics there. That's why they buy up practices.
Can you discuss kind of the differences? I know they're two completely separate things, but neurosurgery and neurology, how they kind of link up, or how are they different?
Yeah,
well, why you didn't choose neurosurgery?
Yeah, well, I hated, actually I didn't hate it. General surgery was kind of fun. In its fourth years, you'll all rotate through, if you go to med school, you'll rotate through general surgery. I'm just not a morning person. Those guys really get up early. You got to be born, I think to be a surgeon, you got to be born a surgeon. There's not many people who go through a surgery rotation. Boy, I love this. I want to be a surgeon. Usually they arrive at med school wanting to be a surgeon. But neurosurgery is a subspecialty of general surgery, as opposed to neurology, which is the medical care and treatment of the brain, spinal cord, peripheral nerves. Neurosurgery is the surgical treatment of that, as opposed to a 4 or 5 year residency, which neurology is. It's a 7-year residency for neurosurgery. First year is general surgery, and then there's a year of research usually, and then 5 years of neurosurgery.
Just strictly neurosurgery?
Yeah, yeah. And so, you know, at MUSC they maybe take 1 or 2 a year, and those guys really they work closely with one another. But you got to be born for that. That's early morning, late night, any kind of trauma to the brain, you'll get called in. And those guys do a great job. But it's I mean, we interact a lot. Postoperatively, you say if somebody has a big meningioma surgery or somewhere and the neurosurgeon excises that. Postoperatively, they usually want a neurologist handling that patient. They don't want to have to do that. And they probably shouldn't have to do that. So we interact a lot. We did some rotations together in residency. But neurosurgeons are surgeons, so you've got that surgery lifestyle and surgery mentality. Thank God for them. They do a good job. It's tough.
So you would never, like your job description, you wouldn't have to like sit in or like assist in surgeries or anything?
No, I would never do that. No, not since med school. The only time a neurologist goes into OR is to do some of the spinal cord monitoring, like neurosurgeons or orthopedic surgeons are doing a spinal cord procedure. Well, they'll want a neurologist to study the electrophysiology. In other words, send a signal up the spinal cord. There's a lead up here, just to make sure everything's patent while they're doing the procedure. And that's that's a subspecialty of neurology called clinical neurophysiology. Some of those guys go into OR.
What are the kinds of subspecialties? Like sleep medicine?
Yeah, sleep is a subspecialty of neurology. It's also a subspecialty of ENT and a subspecialty of pulmonary. So it's not well defined, but sleep is very, it's neurophysiologic. So neurologists never should have let that get away from us. But it is a subspecialty of neurology. Epilepsy, some people are epileptologists. That's a subspecialty of neurology. Rehab neurology, post-stroke rehab, post-trauma rehab is a subspecialty of neurology. Muscle disease, like muscular dystrophy patients, there's a muscle disease subspecialty of neurology. So there's several subspecialties. And that usually, a subspecialty of a specialty usually entails a fellowship, which a post-residency fellowship. I did one for a year because we do so much EEG and ENT, which is muscular and nerve peripheral studies, that it just behooved me to do the fellowship.
I know you mentioned this earlier, but how does it relate to psychiatry?
Yeah, it's not really well defined, but 25 to 30% of our rotations as residents have to be psych.